extensive needs. Oh, got it. More specifically, this track of the grant seeks to expand the CHRP residential habilitation service capacity. All of the information we discussed today can be found on our ARPA grants, incentives, pilots, and community funding opportunities webpage. We'll have time at the end of the presentation for questions and discussion, so please utilize the chat function for anything that comes up during the presentation, or you can save questions until the end. All right, let's jump in. Next slide, please, Chris. Oh, wait, go back. So our agenda today, we're going to start with an overview of the project, eligibility, what the timeline will look like, submission details for your applications, and then questions and discussion at the end. Now, next slide. So our project overview. As I stated earlier, we're supporting with the expansion of the HCBS Children's Rehabilitation Residential Program Waiver, or CHRP. This grant opportunity provides startup funds to increase access to services not already billable. It's not for direct or ongoing services. We're emphasizing a preference, we will say, on the Northwest and South regions of Colorado. This is aligned with Senate Bill 19-222. We have $1.5 million allocated. We're looking to award 3 awardees, and they may receive anywhere between $500,000 and $1 million each. The funding must be used for supplement and not supplant, and we'll talk a little bit more about that in a little bit. Thanks so much. So fund uses. Allowable activities may include, but are not limited to, navigation to support discharge planning, case coordination, and continuity of care in the community and across systems, expansions of HCPF services that are financially viable and person-centered, with a focus on those children and youth who are at risk for being sent out of state for services or placement, creation or expansion of a step-down service between hospitals and a short-term residential placement, and lastly, staffing costs that supplement work to expand CHRP services will be reviewed with a strong sustainability plan in place. Next slide, please. So supplement versus supplant. Supplanting federal funds is not allowable on this grant. Supplanting is when an entity uses federal grants for a planned expenditure to replace funds in an existing budget. So for example, this may include paying a salary for an existing employee, even if the employee has new responsibilities related to this grant, or paying for part of a supervisor salary who is not overseeing a new staff position tied to the grant. Supplementing is allowed. This covers new activities, continuation of programs when funding is ending, or in combination with other funds for a planned expenditure. Next slide, please. Oh, great. Allowable costs. So capital expenditures are allowed, training and education of providers, project implementation costs, project coordination costs, and program costs for each participant that are not otherwise billable to Medicaid. For example, doing a home repair to create a safe space for a member or client. Note that indirect expenses are permitted, but only up to 10%. Next slide, please. Eligible applicants. As you can see, we have quite a few here. Currently enrolled with Colorado Healthcare Policy and Financing as a CHRP provider is one of them, or you can be currently enrolled with CDPHE or the Colorado Department of Public Health and Environment as a PASA. You can also be currently licensed as a CPA or Child Placement Agency with the Colorado Department of Human Services or CDHS. You can also currently operate at least one residential child care facility licensed by CDHS, or our last one is currently enrolled as a Medicaid provider licensed and operating an equivalent to a residential child care facility in another state. Next slide, please. All right, our timeline. So I believe that our applications were released today. We're doing our voluntary Q&A webinar right now. Submission deadline is going to be August 4th of 2023. The award announcement will be September 15th of 2023. Contracting and pre-grant prep will be September 15th through October 31st of 2023. The award period will be November 1st, 2023 through September 30th of 2024. Final invoicing is due by September 30th of 2024. Next slide, please. Submission details. Section 1, so technical response. We're looking for a cover letter between 1 to 2 pages, signed by an authorized signatory. Organization questions and the attestation signed. These items are solely scored on completedness and are 5 points total. Next slide, please. Section 2, population questions. These contribute to the technical response score. They provide general information about the population served, as it, for example, demographic, size, geography. We're also looking for experience working with complex populations. And lastly, an estimated number of cases declined to treat a clinical rationale. Next slide, please. Section 3 is our project description. So we have a description of proposed use of the grant funding to expand delivery of billable services for child and youth with complex needs. We're looking for a detailed response to items A through D in the application. We're looking for applicants to provide project objectives and tasks and their completion dates as well. We're looking to outline how trauma-informed and culturally sensitive practices are being incorporated. And then 15 points, or total, this is worth 15 points. And we're looking for a 2 to 4 page narrative for this section. Next slide, please. Section 3 also includes our budget. So budget narrative and workbook using provided spreadsheet. This is worth a total of 10 points. We're looking for it to include personnel, fringe benefits, travel, lease space, capital expenditure details, contracts, services, and other funding sources if applicable. Next slide, please. Oh, wow, our questions. I can't see the chat if anything came up. So any questions that we have, now's the time for it.
Brianna, thank you so much for that information. This is Michelle. I just wanted to add one additional thing and apologize to y'all for the timing. We really did our best to try to get the RFA out in advance of this webinar so that y'all would have a chance to look it over before coming and maybe be able to ask some questions. So we do appreciate that none of you have seen the RFA, I don't think, but we posted it in the chat. But since we already sent out the communication, we didn't want to keep, we already postponed once, we didn't want to keep postponing it. So we just were hoping to be able to share with you what we were thinking on this grant, be able to answer any initial questions that you have, provide some information about where to contact us as you review the grant application. If you do have questions, then submit those there. So we really do appreciate you joining us today without having a chance to have thoroughly read through the RFA.
And I had just added, and I think some folks were on both of these, but if we do get a lot of questions, we are open to doing another one of these so that there can be more group learning around the RFA if we're seeing a lot of questions come in, and especially a lot of consistency.
Thank you, Susanna. One other thing too, I recognize a lot of names who are attending today. Please feel free to share this information with your colleagues, anyone you think might be interested. I think several of you who are on the call also participate in our quarterly CHRP community of practice. So following this webinar, I will send information and link out the RFA to that group as well. So please, just if you are able, share the information to anyone you think might be interested.
You can find a link to the RFA in the chat, and there's also the email for questions or comments to send to also in the chat.
So I guess we could also ask if anybody has any questions they'd like to ask now. You're happy to answer those in the chat, or if you want to come off mute and ask any questions or give us any comments, we appreciate it.
Hey guys,
Hi, Carrie. Nice to see you.
how you guys doing?
Good. How are you?
Good, 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 good. Well, I assume your key areas would include Grand Junction. And I was just wondering, do you guys have like some knowledge of other states? I mean, I just feel like, been here in Grand Junction for so many decades. Do you have some ideas that maybe could spark our imaginations a little bit? I just feel so stuck for new creative. I don't know.
Yeah, I appreciate that, Carrie. I think one thing overall that I think we're interested in is increasing some residential capacity. So ideas there could be one. As you know, because you probably get all of the referrals that go out statewide, we just have a limited number of, in particular, more group staffed settings for individuals. So I think we really are interested in building capacity there. With those programs also maybe being able to serve as step downs from higher levels of care like PRTF for kids who are out of stage, or hopefully even maybe preventative if they can get into a setting where their needs can be met to prevent them from going to higher levels of care.
Okay. Okay. Sounds good.
Thanks for the question. And it looks lovely and sunny up in Grand Junction, Carrie. the blue sky behind you and the sun.
It is so beautiful. Oh my gosh, you guys, we have had nothing but wind for days, and today is our first calm day. So it is beautiful.
Nice day to be outside.
Come visit us.
Soon. I actually, this is totally getting off the track, but I might be in July, so I'll let you know.
Oh, okay. Sounds great. All right.
I apologize for my radio silence. I am attending this meeting in replacement for somebody else. So I'm just gathering information and sending it. So
Thank you, Katrina. We appreciate it.
Michelle, I see a big need for like parent education in order to get kids returned home. I wonder, like, is this something that could be part of that as well? Like developing a parent education program.
Thank you. I think that was Sarah. Was that you?
Yep.
Yeah. Hi, Sarah. Nice to hear from you. I think what somebody could do if they had that program could potentially propose that in the grant, and just making sure that, reading through the RFA, that their program does meet the criteria that we've outlined for things that we would consider grant funds for. Does that answer your question?
Yeah, I think so. I think there could be ways, to make that work.
Okay. Thank you. Thank you for the question. Well, Brianna, Chris, and team, I don't know, does anybody else have any other questions? We certainly don't want to make you just sit on the webinar and stare at us while we stare at you and each other. But I'm happy to answer any other questions or okay. Well, Chris and team, do you think maybe we would wrap it up then? And I think people have got the information, and we'll send out follow-ups. And again, we really appreciate everybody's time today.
Yeah, thank you, Michelle, and thank you, Brianna. You did a great job.